Iqaluit, everyone. It is Tuesday, April 20th. Obviously, we're having another press conference, an unscheduled one, but here we are. As always, Premier will start, then we have Minister of Health, and then Dr. Patterson, and then we'll go right into questions. Stay safe, everybody. Thanks.
Ula sakulu minagajaw la April 20 daima initalo si mga Iqaluit sa sakya hatalagata daima China sibulit yo halimalaw ni Minister na hamang itulay kunut ang maluluta Patterson apersusitakoy.
Ublutsiana no mute ko king ami kawi mamang putana maligalok te David Joan si tamani tabbani kataw ma TV ku nuitang itu la tamani to Hilipini ihumagi man. Today we inuk ublutsiana no mute ublumi tadli maulak tu takwa nuwan na yo ta nutango yu no boydoni ma na ulak tu 33 katiluk ta so yu no boydoni 31 Iqalung ni ama mago kingay ni ublumi tikidlu takwa nuwan na yo ta ray ko dim kapiyaw himayut 14,393 Nunavut mil ta hibul la pa mi kapiyaw himayut amata na tuglia ni kapiyaw himayut katiluk ta so yu Nunavut mil 11,282 Kawima yung aman na yok kapyanak to yaksuni kawiman nang ngiluni kano awlang na mga ta tunubumiyot kawjiwak taka wimayang iluta kapya hulong iluta tan anigong na mayo tan nuban na yo ibud pa mi nunubum iting iman nunli magoni ilaktu wala ki hani ta ko maliktaw ko yo malik chakop tigot ana tali tichi kunitan halagi na mayabon amma nunali ilangit apekokta himalang matata ko ating mo hokak wingi ukwak tu luang mangata tan outlet nunali outlet siya kayang ito ayun may kayang mata ko ating mo hokak we ta ukwak pata ta ko nikit hunamia tikiyelit anya wing mo outlet yelit nunali wiluan ita hanayak to yelit ta ko outlangin na kang mata kihenyo kaitiwa su ta ko nunu mute nunaliw aheno outlaga kang inawit outlang ilaw ta ko nunaliw aheno tay ko kihimi outlaga kan la ito outla tam na po nunaliw aheno kawim man na huitong mata nanuban kinanuban na yakang mga ta ko mago nunaliw pa kang mata huli nunaliw ahya ta nuban na yata kung kaptigo kaitiga kanak sugita ko akalung nilaw na COVID April 7 ungatani akalung ni outla ko ay gubit ublu 14 ay himagakak tu an daily lutit nakani niwereng lutit hunamang mi ani lutit piyak tung lutit tana nubang na yuata gal ila nuban na yuak kang na gubit kawi mangin na gubit la ilang yaan ya tu ya hutung mata ay tokluy tu luawit April 7 ungatani akalung na outla la gubit ublu 14 ay himagakak tu mata ko nunu mi kaitigo kan takahuli takwa to how much ngiluni to how much you yaksuni ilangi dawni kama to lo mata kiname anuban na ya ta kawang iman kiname anuban na ya mai to lo gwang iman nalau chalota kinanuban na ya kang mga nakipilaw mga kanonu umitilaw mga takwa tiyan ukang iluta ta ko ihiw maging ilugit ta naliswa kay mga kut pilagay ko ting ama anya tailiti ko pilagay ngit ta ko kami gina magi nuno mi to haw magi akalak pata tabuna TV kut ama nalaw tikut ama ikakay kut to hak titaw na to huli unit na matchak to ni ama nikalungaluang iluta ko we hung nilugluta ino katibu nagligayabu inna katibu takwa nunula katibu ikayolugit pichalugit amata kwa anya gaili titi kut malik taw ko yang malik chalawut agaw ang miglugit ublaluk tangiluta katingalo tangiluta am takwa lukta malik kuptigutan nuwan na yuak ihulin niya kawi mamasunga takwa malik chana mata takwa nunuun miu amakingulak pami o kakunga Taina nuban na jata ay kut kaput kapiyaw himangin na ko huli nunubum yun o kaluglutit kapiyaw yak taw makutit tana nuban na jata ay kut kaput atud larigman ikayong na Nunavut miut aluktanin kapiyaw hamang inawit kapiyaw yak tomapuhi matna. Good afternoon today. We are reporting 5 new cases of COVID-19 in Nunavut. There are now 33 active cases in the territory. 31 are in Iqaluit and 2 are in Kingnai. To date, 14,392 Nunavut Mute have received their first dose of the Moderna vaccine, and 11,282 Nunavut Mute are now fully vaccinated. They have received their second dose. I know how uncertain things are right now, but I ask everyone to remain calm and stay strong. We have had some requests to close airports and all air travel in and out of some communities. I need to point out that this is not a practical solution. There are always reasons why being connected is necessary. Essential goods and services, emergency, safety situation, health emergencies, and more. However, non-essential travel is highly discouraged. I'm reminding you that if you don't need to travel right now, just don't do it. It's that simple, because right now your actions could impact everybody's health. Again, if you are in Iqaluit and have traveled back to your community since April 7, you must isolate at home for 14 days. That means don't go out for groceries, don't run errands, and don't take chances. This is very important. Ask for friends and family to do your contactless drop-off. Nunavut Mute, now is not the time for rumors about how COVID-19 came into the territory or who might have the virus. Now is not the time to spread misinformation or scare people with opinions that are not facts. This is not the time for negativity. Let's stay positive and be kind, and pay strict adherence to all the public health measures. And if you have not been vaccinated, book an appointment. There's no use in being scared if you can be prepared instead. Stay safe, mask up, wash your hands, keep at least 6 feet distance from others while you're outside, stay home as much as possible, and get vaccinated. Thank you, Nunavut Mute.
Ublukut. Ublumili ukhausaqarjugu mayunga ilitarayo mablugitamakko aungiksi waktut pilari waktu tamakkuninga qawisarbi ilunginni taamna pinasuaruseriaguput turangang mailitarsiner tamakkuninga aungiksi qawisarti waktunig lutamakkununga gawamakkununabuk kiggartortugin quyannameeqqapsitamatumminga pilariaqaqattartusi maanna piluavik tillugu nubagjuanne qartillugila pilerinnasuungmata ublulukta unnualukta tamanna siammakhunagu quyannameeng. Good afternoon. I just want to take this opportunity to recognize that this week is Medical Laboratory Professionals Week. On behalf of the government of Nunavut, I just want to put a shout out and a huge thank you to all our lab staff who have always worked tirelessly but have been working around the clock since the start of the pandemic over a year ago. Their work and dedication has been one of the most important steps in our COVID-19 response. Again, I thank you. Tapsuma siwulaktip tauqawsa qawayangilangin uqakkannero matuinnarlugit tamakku maligiaqartavut tamaptaluktaat ciammaringila nunavummi naalagiaqaraloarapta tamakkuninga matuarnik nioriikkutinik atorluta inutuniangittaraangapta amma agavu ermeinnaqattarlutigut inugiaksittaililutalu tamakkua ayongnaqattartuugalu kisiani maliglutiguungmat nunaqqativullu ikayorniaruptigut uvaptinniktav ikayuqatigiigiaqartugut kingullerpaamik inutuunasugiluaruvit ikayoktoyaqaqasugiuvillu ikallungaguvilluunni ikayoktoyunnartutit uqaluglutit akiqanngittumut 1-800-265-3333 mut Time na ang may bigayun ng ikong ni pekatao kalog bigayun ng tayo 1-866-804-2782. Ta kuno nga ukalokat tarit si inutulo ka sa gigup si o kakati sa kangigup silo. Ikayok tao yun nakto si. I just want to also reiterate some of the things the Premier has said. It's critical that all of us, every single one of us in Nunavut, pay attention to the strict rules with public health measures. Again, wear your mask, wash your hands often, and listen to the measures that are being updated daily. It's going to be hard, but we all have to do our part to keep Nunavut a safe place in which to be. If you are struggling, feeling alone, disconnected, or anxious, please reach out to your friends or family. And if you need, there are helplines available, toll-free numbers. One of them is 1-800-265-3333 or 1-866-804-2782. Alat yakta, ino katigit yalo talokoyan namin.
Good afternoon. Yesterday we confirmed 2 cases of COVID-19 in Iqaluit. While we knew that the 2 individuals left Iqaluit before the first case in Iqaluit was diagnosed, our initial contact tracing was not able to determine a direct link between these cases and confirmed cases in Iqaluit. This morning we were able to establish a direct link with the outbreak in Iqaluit. However, this demonstrates that there is increased risk of introducing COVID-19 to other communities in the Baffin region. As of today in Iqaluit, all non-essential services and government offices must close. Indoor gatherings are limited to a household and up to 5 people for emergency purposes only. And outdoor gatherings are limited to 5 people. All indoor public gatherings are prohibited, and the schools have moved to stage 4 and daycares must close.
Ano sakut ipatsa naluna sila utugu makunig naluna tao si mayunik nuwadyo anak 19 linik kingang ni. Kaya malawalo atugu takwa makuk ikaluni nga tuminig sibulik pak ikaluni naluna tao lautin nagu. Si pigeli sa tiluta katiyaw yuminang nakawi sa namun naluna sigun nalawang itugu turangan na mga tatakwat ikaluni naluna tao si mayunun. Ulak naluna sigun nakawi turangan ingin ni tamahan ni nakingang mga aksama palian ikaluni. Kasi ani taman na naluna tao yok taman na ulugan anak kan nero tao gunang ningin no sakiro nang ningan nuwadyo anak 19 asingin ni nunalin ni kikiptalum mi. Ulumi pigalugo kingam ni Pimarayong ito piyisirautit kava makulan labingit matugialit. Ilu ani katikatarun namnit isulita bitatut ilu meo katigit kakan nga gulo talemanik kasi ani tuaver nakto kupular tagun narluti. Sila milo katikatarun nakto isulita bitatut talemauluting. Atang yaktu ilu ani katikatarun namnit isulita bitatut tayon. Ilin nabi matuyaw si maning ikutin nilisita mga no tayot ang malupay revit matugialit.
All travel in and out of Iqaluit, including by land, is restricted. Anyone wishing to travel to or from Iqaluit must have a clearance from CPHO travel requests at gov.nu.ca, and travel will be limited to essential reasons only. In the remainder of the Baffin communities, indoor gatherings are restricted to a household plus a maximum of 5. And we recommend that this is from one other household only. Indoor gatherings in halls, conference spaces, government offices, Inuit organizations, and hamlets are limited to 25 people or 50% of the rated capacity, whichever is less. Outdoor gatherings are limited to 25 people, and the schools will move to stage 3, and daycares may remain open.
How papigalu ni tiki beo hataron nam ninga aular beo hataron nam ninga Iqaluit ilagi yaulu ni nunakku patagun nam ninga isulit tabitati tawbo kina tuinak aular umayo kingam not ubalu kingam ni nga umayo ang yaktaw si magialik alabinganik harisaw yakut cpho.travelrequests@gov.nu.ca. Ang itaw kasuarlo ti aulakon ng mga pikisani pimario yung napitso ti harlo sa aulakon na katsi. Asilimahin nakikitalo minunalin ni ilu ani katikataw ng ning isulita bitati tayo ilu meyo katigit ang malutal lima kakan ning agot asinganik ilu meyo katiging itangin ning. Ilu ani katikataw ni pingwabin ni katimabinni gawamako alabingin ni inu katutsa katigingin ni hamalakun nilo isulita bitati tayo 25 no inu katiginut ubalo Abalo ang ita takwa katsiugun ng ita ilu ani naliato ina mekinak sa malita ulunik sila mi katikataw ng ni isulita bitati 25 ngugun ng luting amalo ilin na bi matuingagun ng ni hutinilik ta 3 mo tayo amalo pairibit suli matuingagun ng tuting.
These new cases in Kingite cause concern that there is greater risk of transmission in Iqaluit. I strongly urge everyone to follow the public health measures, wear a mask in public, and stay home as much as possible. We also have an additional 3 cases today in Iqaluit. All of these new cases are linked to previous cases in Iqaluit. If you are sick or believe you have been exposed to COVID-19, please call the hotline at 1-866-975-8601 to determine if you should be tested.
Isn't it 888?
It's 1-888, yes, sorry, that's a typo, thank you. The hotline number is 1-888-975-8601. And please do not call the health centers or the hospital unless directed to do so.
Tako ano ta naluna tayo kingang ni isamalo natun amalo tako ulura natun min sa lutik sa mapalagon nak ni kalun ni ayaw tuiga laki pong akikulimani malikulugi ana hamang itulorin ng mamalitaw galen ni matuwak si makatarot siya ni na ito arot siya amalo ang ikas ni magasawa katalo si pigon nak ni limatsin ni ulumi pingasip ka ni naluna tayo hasi maliktuy kalun ni Tako ano ta naluna tayo yutuka nga yutay kuno nga sibulamin aluna tayo lautune kalonni. Kani magubit ubalo ni katiya hatu mini usuri gubino wadyo anak 19 limik ukalagun naktuti uvunga unga situmaki kangitok 1-888-975-8601 naluna sigaswalo te kawi saktaw gun ng mga pin. Ana bin ukala katatayligit siya na balog nulo ni tayo may akangito akot siya.
Currently, because of travel patterns from Iqaluit, we do not believe there is a need to alter measures in the Kavalik or Kitikmeot regions. However, out of an abundance of caution, masks are now mandatory in Rankin Inlet. We are monitoring the situation closely and will alter measures in other communities if it becomes necessary. Thank you.
Mana yo tamakwa labbe hatam ningi tikibbe hatam ningi loe khalon sulu yo sangit tugu tamakwa sejaqtaw ga ham ningi ni malitaw ya le kivaller me khitam me unilo kisi ani le ujjo sutsiaru mallo tawlo ga naqtumi tayle titsigo mallo talo tay ma mato arsi magari asago be khangit tumik kangersenam me khawi saqpallangin naqtabu tamanna amalo asijja yaqtabu malitaw ga le yasingin nunalin tay may ga kharotta koyanami
Jackie McKay, CBC News. Can you clarify what the connection is with the cases in Kingite to Iqaluit and why there is concern of further transmission in the city?
Jackie McKay, CBC, kung ito kisinaktigaron na kiyuhano ito kaya nga mga takingang ninaluna ito yung tamani kalun ni ang malusumat siya makbiyo ka niron na so bigi tamani kalun ni.
The link between the cases in Kingite and Iqaluit, there is a direct link that involves a family member and direct contact. The reason for greater concern about the transmission in Iqaluit is we have all told the number of contacts is continuing to increase, some of whom are symptomatic, waiting on test results. We know there's a number of people who contracted COVID-19 in at least one of the bars in town, so there may be other people as well.
Tako aturangan ni naluna tau si mayo kingam ni tema aturangan ni hanga tatamanga ilagi ni katisi yuminiu ni nganut amalo kati ya haptu minu nang minuas ni ngano asingin ni tema mataman no lugar na kutau vusa mapalakan na nang nga halon ni tako alo katisi mayavu ila kati ya usimayo ilangi tema kano iguti hakpalya alak sutik utak hiningin ni tema naluna tau gaswang ni novadjuan ak to hamangata tako novadjuan ak ta simayo ilangi imirbimi novadjuan ak ta laungata asingin no tema naluna tau simangin matakiko kati ya kallatak to minimangata.
Previously, you've said that the capacity to deal with a COVID outbreak in several communities will stretch our resources. Can you tell us how stretched the resources are now, and how many communities would COVID have to enter to reach that point?
Uhasima gavita ko piliri juti sa kaunang ni amigas sivalega yang at novadjuan ak ta to hamka nunalinni. Manna yoka ko amigas sivalega ka kanutigi amalo hatsi nunali taima amigas sigaya kapiliri juti sani.
It depends a bit on the staffing in the communities at the moment. Some communities have extra staff in them already because of other preparations, and on how many people in the community have gotten the vaccine. So it's really hard to predict at this point. We could certainly accommodate, we could certainly respond to at least one more community and be able to manage that successfully. After that, it's going to start to stretch resources.
Adjige hatta jang tita ko ilangi kanayak ti haut sa tu nunalini ilangi nilo nunalini kanayak ti hakkanit sa tu galoan kisani asingin upalunga yak sumalawngata takwa lo khatsi kapiyaw si mamangata malitu gitaman nalunak to kano nalaw sa kaswaranga kisani ataw ilakkan nga ni nunalimi no kadyo anak takbiyo yo hakhatay ma nalunang nito amigak suvalyalang na katapiliriyit sanik. I'm a
transfer the Canadian Press. Did both of the individuals in Kingite contract COVID-19 in Iqaluit?
I'm a transfer Canadian Press community ko tamakiking ang ninubadyo anak ta si mayo nubadyo anak ta katamani kalumni.
We don't know that for sure yet.
Taman nasuli ka yung mga itavusuli.
Just to follow up on that one, so it's potential that one person caught it here and passed it on?
Apiriga kanirlugutan na ay pa tamani kalumni. Nubadyo anak ta tuminiuto na kaili tavan isang matakaw.
That's correct, but it's also possible that they both caught it in Iqaluit.
Taman nasuli yo kasi ani tayo matamakki kalumni ta ko nubadyo anak ta tuminiuto na kahamiyo.
And can you clarify when these people left Iqaluit?
No, aga. For privacy reasons, we're not going to get into that.
Justin Bitar, Nunavut News. In your response to one of Jackie's questions, you said one of the bars in town. Do you mean the storehouse, or is there now another bar that's being looked at?
Justin Peter nunat sa ko ni Jackie kyo katarabiw ta ko ilangan ni merbimiw na katarabiw storehouse mi basik lo mi balwasiani.
Sorry, yeah, it's just the storehouse at this point.
Itay kanito ay merbimi sirlo mi.
Were the two individuals that tested positive in Kingite yesterday, were they symptomatic? Is that why they were tested?
Ta ko makunalo na tawlo to kingam ni kanu igut halan ng atita makay saktaw lakilang naka.
At least one was, and I'm not sure about the other yet.
Ay pangatay ma kanu igut halak tumini kisan ay pangato sa mangita ka.
Trevor, Nunavut News. Given the way the contact tracing investigations are currently going, are you expecting cases to continue to rise here or in Kingate?
Trevor, right? Nunavut News kumnita ko katiyaw si mayo ni kaway sa palya tilusi Niriuna kame songo paleane arningin ni tamani Iqaluni kingarnilo.
Too soon to say for Kingite, but for Iqaluit, yes, we'll expect to see more cases.
Khila mi ulo atu kiuga soanga kingarno kisani tamani Iqaluni nalunang ito tayo mami songo kanne paleane arangi.
Next one's to the Premier. Is there any assistance being considered for the Iqaluit Society or any of the shelters here in Iqaluit from the GN?
Pamasima yo kaika yok tao na mga tao society ko Nunavut government kong ini. Eko yang kahangit ko bi.
I have not received the request yet. I'm not sure if the Family Service Minister does, but if help is requested, then we will look at it. Maana te homang ito nga ko takut tamani kalung ikayak to ang mga tayo makatay na inundiri ko minister nga kawi mayak to la ihani ikayak to ang napatatan takuya ayak to.
Jackie McKay, CBC News. My question's for Dr. Patterson. For the positive cases in Iqaluit, can you confirm if they have a travel history to Iqaluit?
Jackie McKay CBC kung nitay ko analo na to yung kingam nitay ma Iqalunit tumini yung mga ti how yung manaka.
Yes.
And considering how things are growing, I know that we're not sure how COVID got into Iqaluit, but how important is it at that point to figure out how the cases started?
Isa magilugot ako kano Iqaluno tikin na mga Nunavut 19 how yung mayang masuli kano pimari utigi pataman na how yung mayaw gaham ninga.
It's important in the long run for after this settles for future efforts to minimize the chance of it arriving. For right now, the important thing is to track down all routes of transmission and stop it as soon as possible.
Pimari unya to sibuni sa tine takwa kano ili ako tigina taktino asidyo tao gayang mga kano ili malitaw galin ni sa maktaylitit sinamo tayo may manaking mga kano lima how yung gaswak tabo.
I'm returning to the Canadian Press. So were these two individuals in Iqaluit not found through your initial contact tracing?
I'm trying to Canadian Press kung nitako mako kingam nito how yaw ningito katiyaw yuminam ni how isak palatilosi.
That's correct.
And I know the Premier touched on this and you did too, but I'm hearing from a lot of people, why are we not shutting down the entire region? Why are we not shutting all the schools down to stage 4? Can you clarify why you're not making that move at this point?
Sibulak tilo kakawagati sumata tako matuyaw si mga takisulima atos soto kay nakatanga tako alilin na bid tiniliformi matuyaw ng mga tao si nakisuma mga.
There's harms associated with closing the schools and other lockdown measures, and in the case of Iqaluit and Kingite, where we know there's COVID-19 in the communities and possibility of spread, it makes sense. The benefits of getting the COVID under control earlier makes sense. In the other communities where there's no evidence of COVID-19 in the communities right now, it's not helpful and may do more harm than good.
Tako akang ili rutaham na sagun ng ngata matuyaw katatilugin ni api tamalakisulimama matuyaw katatilugin. Kasi nilita mana Iqaluit ni kingan ni Nunavut na to ham ni nunalin ni tema tu to ham na pangu masamak tailitit siluni. Asingin nili nunalin ni tema nalo na ila how yinak to sa mga Nunavut na to ham ni nga ni man na yo ikayuta kakayang ima akang ili rutaham na sagun yang atako kisulimama matuyaw pata.
Savikataaq, News. don't know if you said this already, but are the two individuals in King in the same household?
Dastin Patterson na siya kung ni kako kingang ni makuna luna to yung tabangat siya na ilumeo katigipa.
We're not going to get into those kind of details.
Tamat kuning ako sa kadyangit sa makitu.
What do the travel restrictions in King mean for people that are trying to return home to the community?
Tako tikibigon nang nga no isulit tabi tayo nguyo kingang ni kanulik yate ko nga tabong au tiraswakto.
People who want to return home can. They should contact the CPHO travel and get the letter of authorization. People who are wanting to leave Kingite to go home, they'd have to be returning home and they'd have to be willing to isolate for 14 days whenever they get wherever their final destination is.
Taiko angit kami no kingang no tiro mayo tiro nakto amalutak sumonga tutsarun nakto ti CPHO awla ko manamo angit tao gasalo titik katara harayang ata kingang mi ulang ka ila no namin no tiro mayo angit ka nakto galo kasi ni ulo ni 14 ni angit anit teliga harayak sutitabo nga tikik kuti.
Chair, Nunavut News. I got a couple of questions from the Education Minister.
Go ahead.
Okay. How well prepared is Kikitani with learning packages and remote learning in the schools?
Kano tigi palong ayak simat siya kakikita ni tako ilinak ditawagun ilinak na ng mga kamin ni.
Ako yun namin sibuldak pa mi kingang mintud isimagiwag ka malu makakilamilikot niwadjong na teka ni gunin lawag dito. Ito kasi magakot tako rin niyang vid na may limano na iluani pang nautingin ni atok padlian niya si yut teko nga narunay ko ta 4 o balo narunay ko ta 3 Millet when atoring minute atolaktichivalet chautigum naksiyut. Thank you for the question. First of all, my thoughts are with the people of Kingate and hope the people that are experiencing this firsthand are the positive active cases. I hope they recover expediently. In terms of the question for schools, I believe, as far as I know, that all schools should have their implementation plans on whichever stage, whether it's 4 for here as well as Kingate, or if it's stage 3 across the Baffin. Those plans are in place and are ready to activate.
Are there schools either here in Iqaluit or in Kingate that are still waiting on packages or devices?
Ilinak biya halon ni kingang nilo sulu takhiwa tamak kuninga harisaw yakalani.
Takwa angin kami pidira jaksaw katang natuloy niya ako tiksait suglo angin kauti niyak tamin ni tanak kasukta wala nak ilinyak bikutigut tukisigiya ako nak angin jakka kaya jut ilinyak tit ilinyak ilisay dingin tigutlo ni balon ilinyak bimut tukisigiya luti kanupin yang mangamin ni. Tako pang nauti maliglugit amalo atang nang inapako tako atoka nakatigo kasi nito tako kagasaw yakalani tunak to si majun nawik to din nakbit tako tuka nga ju kubasin ni 11 amalo 12 no tako tunak to nyamito tako nang ilinyak tino. For the learning package distribution, I encourage parents and guardians to contact their local schools on how those will be distributed. I believe parents have started, or if will not, or will continue to get regular communications from their school or teacher on how those will be rolled out. But in terms of devices, those are already on hand at each school, and those are directed for grades 11 and 12.
Jackie McKay, CBC News. My questions are for Dr. Patterson. Have you deployed rapid response teams to Kingite, and if not, when would you?
Jackie ma KCBC kunnik aulakti simalaki tuavernakti kuika yoreartini kingarni tavunga sumangi patalite makanga.
Not at the moment. There was already an extra public health nurse in territory. There was one set, or in the community, pardon me. The second was set to leave, but we're going to delay that departure and support the response remotely as well as keeping that extra nurse there.
Manna yoaga ta ikani anna siorti mitav tekani to hatso tigelo to kingarni ta naipangan anna siorti tavunga tikitti tauga soornanga kingoreartaune artu tamani harisa yakko halau tikullo ikayonga kenalloni.
Has any of the positive cases reached the Baffin Correctional Facility?
Takwa nuwa joana taasimayu teikunga ikayoktavimmo simayokalaka.
There's been some staff who are off, but no inmates have been affected.
Ikana yaptini nukanga titaw yo hatugalo kisani tigo yaw simayuni naluna taw simayokangito.
I'm a transfer of the Canadian Press. Since you said you didn't find these two Kingite residents through contact tracing, what does that mean, and are you doing anything differently to try to find additional contacts?
I'm a transfer Canadian Press kunitako makko kingang naluna taw yo hawi yaw yuminung inna avigi kati yaw yuminung hawi sartilo se hanu ileo kajyo itamitaman na pilogo.
So based on the advisories we had put out about traveling from Iqaluit and symptoms or monitoring for symptoms, they presented to the health center. I can't remember exactly when. They presented to the health center and self-identified as having come out of Iqaluit, and at least one had symptoms, were tested. We got the results back last night and then did a more in-depth contact tracing and established a link with at least one case here in Iqaluit this morning.
Tako malittugi hawi kaiguti hatalaw tabu ihalunni hawi sahi hatalaw at hanu iguti hakpalle alingi kalo amangata teme meteina kingarni anna bimu hawi kauti yumine hanu iguti khaliqami nammini naluna suni khalunni ngartumini unirartunilo. Hanu iguti khalam nirami taima naluna eguti yo hawi saguti ipatsa naluna tawlautut taina aipangawgalo aipanga ikhalunni ngartumini uningani naluna tawsmayugalo.
I think you said at least one positive case has been linked to the storehouse. Can you tell us how many positive cases have come from transmission there?
Ukakawgubitana aipa sterlo ami emir tumini giangani takwa le khatsio yunalona tawsema yutekani tumini uningin khawi manaka.
Not yet. We haven't sorted all that information out.
Agasuli.
Matar, Nantiac News. Are you able to provide vaccine numbers for Kingite?
Tas ni petano na check ni ukharun na khatsio mga takapiyaw simalakto kingawni.
Not today. Sorry, I don't have them with me.
Ulumi ito aga takwa titiras mayo pisimangitangi.
Based on your definition, I believe it was last week, we're still not under community transmission because all the cases are linked. Is that correct?
Takwa malittugi naluna ilauta tipina saaqussuulortu mitaan tamanna nunalinni saarmaqpalliangin naqarsigu sulitay meippa.
Yeah, that's correct.
This is as of Monday, so this line here.
Okay. So, Jackie, one sec. So Kingite, as of Monday, had 366 adults vaccinated, had received at least one dose, and of those, 267 have received 2 doses of vaccine. Thank you.
267?
Yeah.
Kingamni apekuta koya hatsi kapayawsima mangata 366 innate kapayawsimayut sibulak pangan yamalu 267 makwati kapayawsimaluti.
Jackie McKay, CBC News. How many people in King Knight have been identified as contacts?
Jackie McKay, CBC kunni khatsiu vakingarni katiyaqarsimaniunerartoru taatsumu nuvadjuanartaartuunnu.
As of this morning, there were at least 7.
Ullaamu savenguleqqauju.
Can you update us on contact tracing numbers in Iqaluit and how many of the positive cases are linked to contact tracing or people coming in to be tested?
Qarearunnaqqiitaakua katiyaussimayuni qavisarnisiiqalunni qatsiuvalunalunaertaussimayu katiyauyuminiuninginni.
We've been able to establish links with every case, and I don't know what the exact number right now is because I got called out of the meeting discussing it yesterday afternoon, so no updates on that number for Iqaluit right now.
Nalunaersissimayugutaakua toqaanganiqartuinnauniginni kisaani qatsiumangaa taqauyamangittunga katimatillugu pabbisattaulaunga ippatsa.
I'm trying to the Canadian Press. Can people in Kingite still get vaccinated?
Suli kingarni taana ima tranter Canadian Press kunni kingarni suli kapiyauqattarunnaqan.
Yeah, yes, we will keep vaccinating going as much as possible.
Kapisi giallaqatteinarniartugut piyunnarnilimaattinni.
What is testing capacity like in Kingite right now?
Qanutigilitaakua qauyissartaugunnarningi piyunnarneqartigi vakingarmiu.
So there's no machines, no instruments in Kingite that can run COVID-19 samples. They will be shipped to Iqaluit or potentially to Rankin Inlet by charter or by sched flight if needed.
Taavani qauyissarutitaqangittu kingarni nuvadjuanarmu qauyissarutiuyunik aullartitauhattariali iqalunnu ubbaluunni kangersinermu charterku akilirtaussimayukku ubbaluunni qangatayukku.
Just to clarify, there's enough swabs in Kingite now to test people who want to be tested?
Kingamni qauyissarutitsani naammattun aullartitauhattariartuni.
Yeah, they had many in there already, and we shipped an extra 500 this morning.
Ja missuni piqatsautigilortuama 500 kannerni aullartissiqqaumiyugu ullaa ila ullumi.
Justin Patterson, NCAC News. My question is for Mr. Kusugak. Last week you said that supply chains are not going to be affected. If you walk into North Mart now, you can collectively see what vegetables the residents of Iqaluit don't like because everything else is empty. How are we doing for supply chain right now?
Tastam petaanuna tsekunni pinasaarusiuyumi oqayuga vitamakkuani uviatsauqattarniartu amigarsijaanginnerarsuit kisaanili taikanini uverbialummi North Mart mitamakkua pirortumini pitaqatsiarunneeqata qanorli tamanna tikibiuginnaqattalangavitassalu.
I tamakkua ujjernaqortu niuveriaqalasartut amisuuloorsimangmata tamakkua niuvianguajungningin nunguallaktualulaumata taikani kisiani tukisiumayapkulli tamakkua uterpallianiartut taikkua qangatasoorti tingmisuungit ingiqayagunnarsivalliakkannernialerningi taikani noqqangala kinguvariarsimalaumata usikattartiuyu tamakkuninganeqinik tamakkua kinguvariarsimayunnerpata atsitiluarsimayuminangitto. Thank you for that question. It was very obvious. Everybody's favorite fruit and vegetables for sure. And that's why I had said at the time that you shouldn't be hoarding or rushing to the store. Part of the shortages was caused, I know, because of that. The other was that the airlines had to ramp down for a day or two in terms of supply, bringing up aircraft and supplies. I believe that over the next few days you'll see that things will creep back to being normal again.
Jackie McKay, CBC News. I'm not sure who this would be best directed at, so I'm just going to ask. Many communities with the cases are concerned about their water supply and washing hands. Is the government doing anything to ensure that communities have the water capacity they need?
Jackie KCBC kunami sinne nunalinne samalo tahangata imertartaungin nahattarna mga tagaminiwasa innahattakuyaw ningin no taima kanutamanna kanunalona sisamane akisang matinarnissinni.
Thank you. Where people are asked to stay home, they will likely use more water, and we're asking people to wash their hands often. And a suggestion would be to the hamlets, if they're capable, that they put on extra shifts, as most communities are trucked water and truck sewage. So the hamlets are quite capable, and I trust that they will step up to the plate. Itako naludang ito tako ay himakuyo mata elmi chakutak elmi ayuma kuslu itako agangin ni imang matong na kauna mata tako ham na kut imaka tako imak tauti anak tauti luau dakan daktu luau mata niamata tako hamlet mo ihumakong na to kihena kau yung mayung tako hamlet ayung itu yung mata pening namayo.
Are there financial compensations available to hamlets for water supply?
Kino yaktigo ikayoktaw na kahamlak ko tamatsumunga imertakattam ng mga yoni.
The hamlets, with the way the water is delivered, with the water rates, the more water the hamlet delivers, the more they get paid. So I think they'd be all right. But if they need any assistance, then they can ask, and it will be looked at. Tako hamlet guyut imak ta takina ta homat tako imak anginingi or amuningi atok tugit tako imak mik atok na kaupat tako hamlet kukina ta na kau na mataki hani kayok ta wak pata ini tan taku gayak tabut tan the CGS minister will be on a conference call with the mayors today, and NTI to help. NTI committed to help. NTI committed to help with the water and extra water last year, and they may do that again. Dana CGS go minister nga Iqaluit ko katimaka tang na matako mayors ni taken it tako mayors ko yung apakayu lang na mata CGS minister mo. Amma agani ulak tatako NTI ko kina ang mituni hilaw kay may ham na kuno imakatsa na matatako nunaling mutan.
Sorry, there's just a quick clarification before the next question.
One quick thing, and I misspoke earlier, I think some of the correctional facility staff may have been named as contacts, but not as actual cases of COVID-19. Sorry about that.
Tamatomini o kaumatay ka ni kayoktaw bimi kanayati langit apikutaw kaumatay langi katisimi yumini utuin na kayali kisyan nalo na taw si mayakang ito nuvadyanak tutas si maningin ni.
For Dr. Patterson, please. Emma Trench of the Canadian Press. I know you won't tell us when these people left Iqaluit, but is there any risk to the others that were on that flight?
Emma Trench of Canadian Press kung niyo kaung nakawin na bitako kangaw laktumini yung mga ati halon ni ulugan naktumini pakayday ko kangatayo katuminingin.
No, they left before the first case was identified and only became symptomatic a couple of days ago. So anyone, if there was any concern about that flight, we'd announce it as well, but there's none.
Aga, teko aulak tumini yung matisibulla panalo na tolongin ni ganita mane halon ni makulu na simalektu kanu iguti hakpalala tumini yung matako nalo na tolak ilautu. Isamalu taon na kataman na kausari simalekay kayak tabo hangata katawlak tu mitsano tay may isamalu na to kangima kausari simangitabo.
If there's no other questions, that's great. I do want to clarify that the mayor's call will be tomorrow. It's not today. Thank you.
Apikuti sa kaun ni anak to kisinakti sige ato kaupa mayor kati makatawlak to kaupan kikitalo.